All right, good afternoon, and thank you for joining us today for the COVID vaccine, Employers' Best HR Strategies, the ADA, and Staying in Compliance. I'm Jackie Petroselli, the Marketing Specialist here at MP. For those of you joining us on a webinar for the first time, MP is a full-service human capital management services company offering a suite of products and services including HR, payroll, benefits administration, time and attendance, and compliance. We support our clients with cutting-edge technical solutions as well as proactive, reliable service and deep HR and payroll expertise. MP is wired for HR and helps clients succeed by tying their operations to their business goals. Your presenters today are two of our lovely HR generalists here at MP, Sherry and Amanda. And with that, I'm going to hand the mic off to Sherry to get started.
Great, and thank you, Jackie. Welcome, everybody. Good afternoon. Our legal disclaimer, we are going to be talking a lot about employment law today, but we are not dispensing legal advice. The training is intended for educational and informational purposes only, and nothing we say today should be construed as legal advice. And with that, presentation topics today. So we're talking about COVID-19 vaccine, but in talking about that, we really need to talk about the ADA. So we'll do a quick overview of the ADA for those of you who are either unfamiliar or need a refresher. Excuse me, and then we'll talk about COVID-19 vaccine and the ADA and some specifics on HR compliance concerns. Amanda's going to run through some COVID vaccine FAQs that were put out by the EEOC, and then we should leave a good amount of time for live Q&A. So as Jackie said, please be sure to send us in your questions throughout the presentation. And at the end of the presentation, we do have some COVID-19 and ADA resources slide available. And again, this slide deck will be sent out at the end of the presentation. And with that, let's jump right in. The Americans with Disabilities Act. It's actually really hard to believe that it was 30 years ago that President George H.W. Bush signed the ADA into law. So with businesses and schools opening in the midst of a pandemic, and the ADA is more relevant now than ever before. Before we dive into COVID-related accommodations, let's review just some ADA basics. So the ADA, excuse me, which was enacted in 1990 and amended again in 2009, protects people with disabilities from discrimination in employment, and programs and activities offered by state and local governments, and in accessing goods and services offered in places like stores, hotel, restaurants, doctor's offices, and the like. So Title I of the ADA protects qualified individuals with disabilities from employment discrimination. And it also prohibits employers from retaliating against an applicant or an employee for asserting their rights under the ADA. Now, the ADA applies to employers with 15 or more employees, but it's important to remember that many states have laws prohibiting discrimination against individuals with disabilities that apply to employers with fewer than 15 employees. For example, here in Massachusetts, our anti-discrimination laws apply to employers with 6 or more employees. So just because you might not be a covered ADA employer doesn't mean that you shouldn't pay attention to some of the guidelines, especially in the middle of this pandemic. So who is protected under the ADA? So under the ADA, a person has a disability if they have a physical or mental impairment that substantially limits major life activities. The ADA also protects individuals who have a record of a substantially limiting impairment, such as somebody who's recovered from cancer, and people who are regarded as having a substantially limiting impairment, meaning that they have been discriminated against because of an actual or a perceived impairment. So when we talk about major life activities, we're talking about hearing, speaking, walking, performing manual tasks, thinking, really just all the basic functions we need to go about doing things during the day. Excuse me. And then examples of physical impairments would be things like blindness, deafness, cancer, cerebral palsy, HIV infection, emphysema, multiple sclerosis, the list goes on and on. Examples of mental impairment would be things like depression, anxiety, schizophrenia, learning disabilities, intellectual disabilities, or autism. So who then is a qualified individual under the ADA? So under the ADA, an individual, to be considered a qualified individual, You have to be able to satisfy the job requirements for education, experience, skills, licenses, and any other job-related qualifications. And you have to be able to perform tasks essential to the job with or without an accommodation. So let's dig deeper a little bit into that as far as the essential job functions. And this is going to be really important now, again, with all of the things that we've been facing through this pandemic, as far as disabilities that might come out of COVID-19, and then also in coming up with a policy for the vaccine. We really do need to identify what those essential job functions are. So those are the basic job duties that an employee has to be able to perform, again, with or without an accommodation. And that is, those are things that you really can't give to somebody else to do. It's really the essential function or the purpose for being. So for example, in a restaurant, an essential function for a wait staff is to be able to carry, lift, walk, all of those things. When you're waiting on tables, those are things you might not be able to pass along to somebody else. Now, other areas, other responsibilities might include things like doing stocking or sweeping or cleaning. Those might not be essential functions of the job. They might be things that other people could do. So, excuse me, what is a reasonable accommodation? And this is going to be very important to understand, again, especially as you're coming up with policies for how to handle the COVID-19 vaccine. So an accommodation is a modification or adjustment to a job, the work environment, or the way things are usually done that provides a qualified individual with a disability an equal employment opportunity. So that accommodation is going to be able to give them the ability to do the essential functions of the job. What a reasonable accommodation does not include are things like removing essential job functions, creating new jobs, or providing personal need items such as eyeglasses or mobility aids. Now, an employer needs to provide accommodations, reasonable accommodations that work for both the employee and the employer, unless they create an undue hardship. And the ADA's threshold for undue hardship is pretty high. So it would be, an accommodation would be costly, extensive, substantial, or disruptive, or would fundamentally alter the nature or operation of the business. So an employer is not required to make an accommodation if it would impose an undue hardship on the operation of the employer's business. Excuse me, but you want to take into consideration factors such as the cost of the accommodation, the employer's size, financial resources, and the nature and structure of the operation. So for example, let's say you have a type of business where employees, let's say it's a restaurant, and your employees have to physically be on the premises in order to wait on customers. That's an essential function of the job. However, the person who handles your administrative work, for example, the bookkeeper, payroll person, human resources, whatever, maybe having them work from home could be an accommodation, even though you feel like they need to be in the workplace. If you have to look at the job functions and say, can these job functions be performed outside of the workplace? And if they can, then that might be considered a reasonable accommodation. An employer is not obligated to provide an employee's preferred accommodation if another reasonable accommodation exists that enables the employee to perform those essential job functions. So you don't need to give them what they prefer, just what will work. And the most important part of the ADA, or complying with the ADA, is the interactive process. So to help determine effective accommodations, the EEOC, Equal Employment Opportunity Commission, recommends that employers use an interactive process, which simply means that employers and employees with disabilities who request accommodations will work together to come up with the accommodations. The interactive process does not end just because an employee's initial accommodation is unreasonable. If this occurs, the employer must explore alternative accommodation options. And with that, I'm going to turn the mic over to Amanda.
Thank you, Sherry. The answer we have all been waiting for. Can employers mandate the COVID-19 vaccine? There isn't a law or regulation that directly addresses this issue. Employers who are considering a mandatory COVID vaccination policy should look at how the EEOC and courts have interpreted mandatory flu vaccination policies. Unless there are state or local laws to the contrary, employers may require employees to get vaccinated from the flu. However, even in a pandemic, the EEOC has emphasized that an employee may be exempt from a mandatory vaccine if the employee has an ADA-covered disability that prevents them from taking the vaccine. Exempting an employee from the vaccine would be considered a reasonable accommodation under the ADA. Also, employees may be excused from a mandatory vaccine policy under the religious accommodation provision of Title VII of the Civil Rights Act of 1964. Under these circumstances, an employee may be exempted if taking the shot would violate his or her sincerely held religious beliefs, practices, or observances. As with requests made under the ADA, the employer must provide a reasonable accommodation unless it would pose an undue hardship. As we just discussed, employers should engage in an interactive dialogue with the employee to determine whether a reasonable accommodation would enable the employee to continue to perform their essential job functions without compromising the safety of other employees, patients, or customers. Potential accommodations could include, but they're not limited to, additional PPE, moving the employee's workstation, a temporary reassignment, teleworking, or leave of absence. Finally, you should be aware of any applicable state disability and anti-discrimination laws. A number of states, such as New York and California, have enacted laws that protect workers during the pandemic. Be sure to take these into consideration when developing your own vaccine policy. Can employers mandate the COVID vaccine policy? So the short answer is a qualified yes. Your vaccine policy should provide for exceptions under state and local and federal laws, be job related, and be consistent with business necessity. The EEOC does not prohibit employers from mandating vaccines, though it recommends private employers consider encouraging employees to take the vaccine rather than requiring employees to take the vaccine. So we're going to take a look at some of the most common asked COVID-19 vaccine questions as an FAQ. The availability of COVID-19 vaccinations has raised questions about the applicability of various EEO laws, including the ADA, GINA, Title VII, including the Pregnancy Discrimination Act. The EEO laws do not interfere with or prevent employers from following CDC or other federal, state, and local public health authorities' guidelines and suggestions. The EEOC has updated its What You Should Know About COVID-19 and the ADA, the Rehabilitation Act, and other EEO laws webpage to include questions and answers regarding the COVID-19 vaccine. A link to the site is on the resource slide at the end of the presentation. Now, let's take a look at some of the most frequently asked questions and answers. Is the administration of a COVID-19 vaccine to an employee by an employer or a third party with whom the employer contracts to administer a vaccine a medical examination for purposes of the ADA? So no, the vaccine itself is not a medical examination. A medical examination is a procedure or test usually given by a healthcare professional or in a medical setting that seeks information about an employee's physical or mental impairments or health. If a vaccine is administered to an employee by an employer for protection against contracting COVID-19, the employer is not seeking information about an individual's impairments or current health status, and therefore it is not a medical examination. There is a caveat. Although the administration of the vaccine is not a medical examination, pre-screening vaccination questions may implicate the ADA's provision on disability-related inquiries, which are inquiries that likely will elicit information about a disability. If the employer administers the vaccine, it must show that such pre-screening questions it asks the employee are job-related and consistent with business necessity. Is asking or requiring an employee to show proof of receipt of a COVID-19 vaccination a disability-related inquiry? No. There are many reasons that may explain why an employee has not been vaccinated, which may or may not be disability-related. Simply requesting proof of receipt of a COVID-19 vaccination is not likely to elicit information about the disability, and therefore is not a disability-related inquiry. However, subsequent employer questions, such as asking why an individual did not receive a vaccine, may elicit information about a disability and would be subject to the pertinent ADA standard that they be job-related and consistent with business necessity. If an employer requires employees to provide proof that they have received a COVID-19 vaccination from a pharmacy or their own healthcare provider, the employee may want to warn the employee not to provide any information as part of proof in order to avoid implicating the ADA. If an employer requires vaccinations when they are available, how should it respond to an employee who indicates that he or she is unable to receive a COVID-19 vaccination because of a disability? So the ADA allows an employer to have a qualification standard that includes a requirement that an individual shall not pose a direct threat to the health, safety of other individuals in the workplace. However, if a safety-based qualification standard, such as a vaccination requirement, screens out or tends to screen out the individual with a disability, the employer must show that the unvaccinated employee would pose a direct threat due to a significant risk of substantial harm to the health or safety of the individual or others that cannot be eliminated or reduced by reasonable accommodation. Employers should conduct an individualized assessment of 4 factors in determining whether a direct threat exists: the duration of the risk, the nature and severity of the potential harm, the likelihood that the potential harm will occur, and the imminence of a potential harm. A conclusion that there is a direct threat would include a determination that an unvaccinated individual will expose others to the virus at the worksite. If an employer determines that an individual who cannot be vaccinated due to a disability poses a direct threat at the worksite, the employer cannot exclude the employee from the worksite or take any action unless there is no way to provide a reasonable accommodation that would eliminate or reduce this risk so the unvaccinated employee does not pose a direct threat. If there is a direct threat that cannot be reduced to an acceptable level, the employer can exclude the employee from physically entering the workplace, but this does not mean that the employer may automatically terminate the worker. Employers need to determine if any other rights apply under the EEO laws or other federal, state, and local authorities. For example, if an employer excludes an employee based on an inability to accommodate a request to be exempt from a vaccine requirement, the employee may be entitled to accommodations such as performing the current position remotely. This is the same step that employers take when physically excluding employees from the worksite due to a current COVID-19 diagnosis or symptoms. Some workers may be entitled to telework, or if not, they may be eligible to take leave under the FFCRA, under FMLA, or under the employer's policies. Managers and supervisors responsible for communicating with the employee about compliance with the employer's vaccination requirement should know how to recognize an accommodation request from an employee with a disability and know to whom the request should be referred for consideration. Employers and employees should engage in a flexible, interactive process to identify workplace accommodation options that do not constitute an undue hardship. Managers and supervisors are reminded that if it is unlawful to disclose that an employee is receiving a reasonable accommodation or retaliate against an employee for requesting a reasonable accommodation or any accommodation. How should an employer respond to an employee who indicates that they are unable to receive a COVID-19 vaccination because of a sincerely held religious belief or practice? So once an employer is on notice that an employee's sincerely held religious belief or practice or observance prevents the employee from receiving the vaccination, the employer must provide a reasonable accommodation for the religious belief, practice, or observance, unless it would pose an undue hardship under Title VII of the Civil Rights Act. Courts have defined an undue hardship under Title VII as having more than a de minimis cost or burden on the employer. EEOC guidelines explains that because the definition of religion is so broad and protects beliefs, practices, and observances with which the employer may be unfamiliar, the employer should ordinarily assume that an employee's request for religious accommodation is based on a sincerely held religious belief. If, however, an employee requests a religious accommodation and the employer has an objective basis for questioning either the religious nature or the sincerity of a particular belief, practice, or observance, the employer would be justified in requesting additional supporting information. What happens if an employer cannot exempt or provide a reasonable accommodation to an employee who cannot comply with a mandatory vaccination policy because of a disability or sincerely held religious practice or belief? Well, if the employee cannot get vaccinated for COVID-19 because of a disability or sincerely held religious belief, practice, or observance, and there are no reasonable accommodations possible, then it would be lawful for the employer to exclude the employee from the workplace. As we discussed previously, this does not mean the employer may automatically terminate the worker. Employers will need to determine if any other rights apply under the EEO laws or federal, state, and local authorities. Is Title II of GINA implicated when an employer administers a COVID vaccine to employees or requires employees to provide proof that they have received a COVID-19 vaccination? So no, administering a COVID-19 vaccine to employees or requiring employees to provide proof that they've received a vaccination does not implicate Title II of GINA because it does not involve the use of genetic information to make employment decisions or the acquisition or disclosure of genetic information as defined by the statute. Under Title II of the Genetic Information Non-Discrimination Act, or GINA, employers may not use genetic information to make decisions related to the terms, conditions, and privileges of employment, acquire genetic information except in 6 narrow circumstances, or disclose genetic information except for in 6 narrow circumstances. However, if administration of the COVID vaccine requires screening questions that ask about genetic information, the inquiries seeking genetic information, such as family members' medical history, may violate GINA. All right, now let's take some time to answer some of the questions that you have all sent in. Sherry, are you ready to be put on the spot?
Ready, willing, and able. And while we're continuing, as questions come up, please continue to send those in. We've got a good half an hour's worth of time to be able to answer anything that's on your mind.
All right, so let's start with what if an employer refuses to put a policy in place and employees working on site feel uncomfortable working alongside employees who are not vaccinated?
That's a really great question. So, and one of the considerations and some of the reading that we've been doing with the various law firms and how people are interpreting some of the regulations in regards to COVID-19 is that we don't know how liable an employer might be, because under OSHA, an employer is required to provide a safe workplace. Now, if you're in a situation where you have employees who have to physically be there. So for example, our office, we're all 100% remote, and that is fine. We can do our jobs remotely, but there are a lot of businesses who physically cannot do their jobs remotely. And they may also have contact with the public, which just increases their risk. So if that employer does not put in place a mandatory vaccine policy, will they be held liable? Could they be? And those are questions that are still to be determined. And unfortunately, a lot of those are going to be determined by lawsuits as they crop up. So as Amanda mentioned, excuse me, through her FAQs, is that the best thing to do is to encourage your employees to take the vaccine. And if you can, provide it at work. So whether you're bringing in, say, once it's available, more readily, you may be able to get a visiting nurse association to come in and provide vaccines to all of your employees at some point, or to maybe give them the time they might need to go and schedule appointments. But you do want to encourage them to do so. But I can't give you a black and white answer to that one yet, because it really is still to be determined.
Great. All right, we're gonna tee up another one. Is asking employees if they have vaccine violations of their HIPAA. Is asking employees if they have vaccine violations.
Is it a
violation? Yeah, violation of their HIPAA rights.
Right. Okay. So HIPAA actually applies to organizations that have medical information. So just as a regular, office environment, retail store, restaurant, whatever, you don't have HIPAA requirements per se. But what you want to be careful of is requesting information that could possibly trip you up under the ADA. You don't want people disclosing information. So for example, if somebody says they can't take the vaccine for whatever reason, it could be that they have an allergy. For those of you who regularly get the flu shot, when you get the flu shot, generally they have you fill out a form, and one of the questions is, are you allergic to eggs? Because apparently people who are allergic to eggs can have a reaction to the flu shot. So that kind of information, depending on what kind of questions you ask, might elicit confidential medical information that could then be pose issues under the ADA and discrimination under the ADA. But just requiring somebody to have a vaccine or proving that they got the vaccine in and of itself is not. You do, however, want to keep all of that information confidential. That isn't something that you would share with other employees. So if somebody does have asked for an accommodation for whatever reason, maybe somebody's pregnant and they don't want to let everybody know that they're pregnant yet, but there hasn't been enough testing done on pregnant women with the new COVID vaccine. So a lot of doctors are recommending that pregnant women hold off on taking the vaccine. So that might be a situation where people aren't ready to announce that, but do need an accommodation for that. It's going to be important for you as an employer to keep all of that information confidential and not share it. Nobody needs to know who has an accommodation and why.
Okay, great. So Michelle has a pretty good question, and it is, what kind of documentation could be requested to prove a religious exemption?
Well, when it comes to religious exemptions, those ones get can get very ticklish. So I don't know that you would have documentation regarding a religious exemption. You want to give somebody the benefit of the doubt that these are sincerely held religious beliefs. Now, if they are saying that their sincerely held religious belief prevents them from getting the COVID vaccine or any medical intervention, you could ask for more information on that. But as a general rule, you do want to just assume that they do have these sincerely held beliefs. You can ask about, though, the nature of why they can't have, why the religion prohibit. Does religion prohibit it, or do the practices prohibit it, or is it something that the employee is interpreting based on their religious beliefs? So you need to kind of get a little clarification on that. Those questions you can ask, but you don't want to challenge whether their beliefs are sincerely held.
Yeah, great point, Sherry. Okay. Okay, we are a medical device manufacturing company. Due to the nature of the business, social distancing is near impossible. While PPE is provided, not all employees take things seriously. Is it reasonable to require a vaccine due to the nature of the business while respecting ADA, EEOC, etc.?
Oh, absolutely. You can mandate, especially if you have good business reason for doing so. So it's really important, again, to make sure that it is a business necessity. And then you also want to make sure that it's not just a blanket, everybody has to get a vaccine. Again, and especially in this, the example that you're giving, is that in your manufacturing facility, obviously, it's going to be impossible for people to work remotely, but maybe the administrative people can work remotely. So somebody who's on the administrative side, who is either, you're going to run into people who either can't have the vaccine due to medical reasons, whether it's allergies, whether it's pregnancy, or maybe whatever other physical conditions. And then the other are going to be folks who really are either just too afraid of it or don't believe it. Just don't believe that COVID exists, don't believe that the vaccine is going to work. It's just a personal belief. So what you want to do is be able to first off sort out why somebody is refusing to get the vaccine or does not want to. 1, 2, you want to make sure that you're applying the policy consistent with business needs. So the manufacturing end, you can't social distance. It's very hard to, you've got to physically be there at work. That might be a separate, that might be a situation where you can't accommodate somebody, whereas in your office environment, the back office people, maybe they can work in a separate office, maybe they can work off hours, maybe they can work from home. So it's really going to be dependent on each situation. For those who aren't taking it seriously, if you do have, we have state mandates right now, depending on what state you live in, as far as wearing and using PPE and social distancing and all of that. So I would rely very heavily on your state guidance as well. And it looks like we'll probably have some federal guidance now with the new administration.
Perfect. This question has a few questions within it, so I'm hoping that we'll be able to chip away at that. So can you revisit the steps that should occur if an employee cannot get vaccinated due to sincerely held religious belief or disability and no reasonable accommodation is available?
Well, so again, when the most important thing to take out of this, if nothing else that you take away this afternoon, is you need to have a conversation. You have to have that interactive conversation. And I really strongly suggest that you make sure that your managers are all trained to have those conversations. Because if an employee in a manufacturing environment, for example, says to their manager, the manager says, I need a copy or a proof of your vaccination, and they say, I'm sorry, I'm not getting vaccinated, you want to make sure that that manager knows how to handle that properly so that you're not putting the company at risk of any kind of discrimination claims. As far as what to ask for, it's really going to be dependent on why the individual does not want to or cannot get the vaccine. Excuse me. And then when you get down to the point that if you cannot accommodate that individual, again, we're going to go into a restaurant situation where you have wait staff. They have to physically, obviously, be there on the premises. Let's say, for example, that the state mandates that food service workers have to have the vaccine. That could be a state mandate unless there are certain accommodations. And maybe you have somebody who isn't willing to or isn't able to. Then you may have to either let them take a leave of absence, which is an accommodation under the ADA. And then again, I think we'll be hopefully seeing some more guidance. Right now, the states have been, I think they've been holding back on providing guidance regarding the vaccine and how employers should handle it, because the vaccine is not readily available to everybody in the public right now. And then 2, I think they were waiting for the new administration to come in, excuse me, and maybe give us more guidelines. Pardon me. So I hope that answered your question. All I can stress is that you really have to have that interactive conversation, find out why, and then throw the ball back in their court. What else can we do to make this happen?
Okay, perfect. Can we simply tell our employees that we want to require them to get vaccinated and ask them all if anyone does not want to?
I wouldn't do it as a blanket conversation, and we will as soon as we have it available. We're in the process of pulling together some sample policies. See if we can't find some samples that we could even send out today. But if you are requiring people or encouraging employees, you want to sort of have it as part of your policy to let people know in that policy that if anybody requires an accommodation or has any issues, who they should speak to. So you really, if at all possible, you want to have them speaking to human resources, not to, excuse me, you may not want to have them speaking to line managers who don't know enough about what accommodations might be available or required.
Okay. This one, so would these leaves of absences be covered under PFMLA? And I'm going to say probably not, because if it's not an active illness or situation where someone is pregnant. But Sherry, what do you think on that?
No, so it more than likely will not be covered under PFML or under FMLA in many cases. Excuse me, but it's always going to be determined. It's going to be decided really based on why they cannot have it. Because if the reason they can't take the shot is related to a disability, so for example, let's say that I have MS. And I'm making this up, I'm not a doctor, but let's say, for example, maybe the medication I am on, my doctor feels that I should not be taking the vaccine in conjunction with this medication because there's not enough research on it yet. That is possibly a reason that somebody may have an exemption or exception under the ADA. So it's really going to be dependent on why they can't. But as a rule, I don't believe it's going to be covered under there, even for PFML, because pregnancy in and of itself is not a disability. You might have pregnancy-related disabilities, but pregnancy in and of itself is not a disability.
Right. These are some really great questions, so thank you all for submitting them. Would it be discriminatory not to hire an individual because they refuse the vaccination? Would we still be expected to make reasonable accommodations if they are not on our payroll yet?
Great question. And the answer to that is basically yes, because the ADA, remember, doesn't just protect employees, it also protects applicants. So if you have somebody who, excuse me, who lets you know during an interview. So let's say, for example, that you have a manager conducting an interview and they mention that all employees are required to have the COVID-19 vaccine, and that individual says, well, because of my XYZ condition, I'm not able to do that, and you do not hire that individual for that reason, you could be discriminating against them under the ADA based on their disability. So again, that's still an opportunity for you to engage in that interactive process or dialogue to decide how you could best accommodate that individual. Now, if you're not going to be hiring that individual because you have somebody who's better qualified, that's a whole different story. But it is really important to make sure that you understand that the ADA applies to applicants as well. It was a great question. Thank you for that.
Yeah, Sherry. So someone had written that the sign-up page for this webinar stated, get tips on the best HR strategies for communicating your vaccine policy. And they just want to know if we'll be covering any of those communication strategies.
Not specific as of yet. We are going to be working on, and we'll have follow-up, presentation on creating a policy. Once again, we're just waiting to see what the new administration puts out as far as guidance is concerned.
Perfect. And then that would be able to be available. As we aim to encourage vaccination, what are appropriate ways that companies are incentivizing their employees to get their shots?
Well, I would be really cautious with incentivizing people to get the shot. Because again, that could have what they call, that could have an adverse impact on a particular group. So for example, if you have a particular group of employees who, based on a disability or a religious belief, cannot take the vaccine, and you're offering incentives, sort of a reward, something for everybody getting vaccinated, then that you're disproportionately impacting those individuals in a negative way. So it might sound like a great idea to incentivize people, but it could have sort of a boomerang effect and come right back at you in the way of a discrimination suit. So I would not necessarily recommend going that route. I think making it easier for your employees to get it, like I said earlier, I know that I've worked for employers in the past who have brought in the VNA to do flu shot sessions every year. Just makes it easier. A lot of people don't get their flu shots just because it's just a hassle to make an appointment and go to your doctor and get it done. So having it done at work is much, much easier. The other thing to take into consideration too, which is going to be really tricky, and I know they're working on this now with healthcare providers, is that that second shot usually does follow with a period of 24 to 48 hours of side effects that would prevent them from working, probably, chills, fever, body aches. So you want to also kind of take that into consideration. We will hopefully, again, have some more guidance very shortly. It sounds like the new administration is ramped up to provide that guidance when it comes to vaccine. So we'll keep you posted on that.
Okay. What is the best way to phrase a question in an interview process to inquire whether someone has taken the vaccine or plans to take the vaccine, and if this question is even lawful?
Well, I mean, can you ask if somebody has had the vaccine if you have a mandatory vaccine policy? Yes, but again, don't forget that the reasons why they may not have could then elicit a response that's going to give you information that you should not have regarding maybe their disability or their sincerely held religious beliefs. And then all of a sudden, if you're not hiring that individual, you could look at discrimination claims.
Yeah.
So I would be very, very cautious with that. The best way to do that is to just make sure they are aware as you're going through the process that we do have a mandatory vaccine policy. And if you prefer to have it done by your own provider, that's fine. Or if you've already had it done, we would just require proof of that. Let them know that, and ask if they have any issues with providing that proof. Not the shot, but providing proof that they got the shot.
Okay, to follow up with that one, does an employee or company have to pay for the COVID test? I would assume if, the company is requiring it and has a vaccine policy that they would be the ones responsible?
Well, if we're talking test or vaccine, so let's talk vaccine first.
Okay.
Right. Supposedly the vaccines are going to be free to everybody. So I do not believe that's going to be an issue. However, excuse me, with the tests, right now, if you are required, if your doctor recommends that you have a test, sends you for a test, schedules a test for you, that is not, you don't have to pay for that. But if you just want to go and get a test, let's say you just went to visit, your grandparents, down in New Jersey for Christmas, and then you're coming back and you need to get that test because of state regulations. Yes, that is something that the individual would be incurring the cost of. So do you have to pay for that as an employer? You know what, if you're going to require it, you may need to pay for it. So I really do recommend, it's getting a little tricky with the tests and the travel and the required quarantine, especially here in Massachusetts and other states where we have a required quarantine period if you go out of state. So, excuse me, it's really going to be dependent on how, if you can allow people to be out long enough to have that quarantine period without having to have a test. Right.
And if there are any reactions from the vaccine, do you think that would be covered under FFCRA or FMLA?
That is very, very possible. Now, and so under FFCRA, with those leaves, that wouldn't cover, excuse me, because those are specifically related to having been exposed to COVID, for caring for somebody who has COVID, or if you are having childcare issues, or have COVID yourself. But reaction to the shot might be, depending on the reaction and how severe it is, could it be covered under the PFMLA? It's possible, I guess. I don't think so, but again, we haven't seen, a lot of what we've seen so far are just allergic reactions to it, which are mitigated very quickly. So it doesn't look like it's something that would come into play.
Okay, wonderful. I did just want to make a note that this presentation, you will get a copy of it at the end, the slides and the recording. You still good to take a couple more questions, Sherry?
All right. Oh, yep. We got more time. Yep.
Okay. Is the vaccine required for critical infrastructure employees?
As yet, there are no federal requirements. And again, I do believe that's going to change. But I think at the federal level, they can only mandate it for federal workers or federal buildings and offices. For example, I believe that one of the executive orders that was signed yesterday was to mandate mask wearing in all federal facilities, all federal buildings. So as far as the vaccine is concerned, possibly. We'll have to wait and see with what comes out. But right now, there's nothing specific.
Okay, so Jason had asked, because we had said that the policy should encourage, not require.
Right.
Therefore, one would have to assume that you can't mandate it. Is it correct?
No, not necessarily, because you may be able to based on business necessity. So if you have a business where you're somebody who is unvaccinated could pose a direct threat. Now, what has happened is because of the pandemic, the EEOC has determined that the spread of this pandemic does meet the definition or the threshold of direct threat to other employees, to customers, or to vendors. So it is absolutely an employer can mandate it. But you've got to have good business reasons for doing so unless you're going to make, and then you also have to be able to make those accommodations as necessary.
Okay.
So definitely, I do believe that the states are going to get involved shortly as far as that is concerned once it's more widely available. And I think they've been surprised at even the healthcare workers who have refused do not want to get the shot for various reasons. So, it's really going to be a wait and see with what the state and the federal governments mandate. And even then, but the EEOC does say that you can mandate it, just like you can mandate a flu shot, but you do have to make sure that you're making those exceptions for disability related or religious beliefs.
All right. One of the slides we mentioned employers administering the vaccine. Are private companies doing that, or will it still be done similar to the flu shot?
I think it's going to be done similar to the flu shot. I think employers who are administering it are employers who right now are in the medical field. So they have people who are trained to do so. I'm pretty sure I would not let anybody at MP give me a shot.
Not even me?
Not even you. No, I just want to make that very, very clear. So no, I don't think an employer, unless they are licensed to do so or trained to do so, will be administering shots.
Okay.
But when they say employers administering shots, generally it's going to be done through a third party.
Yes. So Laura asks, we offer work from home and we are also reopening the office for those who would like to come back on site. Since it's not mandatory to be in the office, it seems we are safe to require a vaccine. Is that correct assumption?
Yes, I mean, you're not prohibited. You can mandate it for somebody who's going to be in the office. And again, if you're allowing people to work from home, then you are already going to be making those accommodations for somebody who, for whatever reason, cannot or will not get the shot.
Okay. Should an employer consider that a vaccinated employee is considered protected against the virus and at low risk from an unvaccinated employee?
You know what, and that's really more of a medical determination. I mean, they say that these vaccines are in and around 95% effective at preventing COVID, but there's that 5% that's still out there. So I don't know that you could 100% say that they are protected. And even once the vaccines become widely available, we're still going to be in a situation where we will still be required to use PPE until such time as it's been completely eradicated.
Yeah.
So I think we're going to be wearing these masks probably, I'd say, probably for the remainder of 2021 would be my guess.
Okay, and kind of along the same lines, can employees sue the company if they got infected at the workplace?
Yeah, so that's going to be a real tricky one too, and that was a big bone of contention with the stimulus bills. because of the employer liability.
Mm.
And it's really hard to determine where somebody got COVID.
Yeah.
I mean, where it is so widespread in every single state. Excuse me. And then with the new variants that are even more transmissible, it's definitely would be hard to prove that. But as an employer, if you're not following the guidelines of the state, providing all of the PPE, the cleaning, all of that, keeping people socially distanced, doing everything that is suggested, can an employee sue you? Could they? They can sue you for anything. Unfortunately, how will it hold up? I think we're going to be seeing that in courts coming up
Yeah.
as employers are making those determinations. So this is where we always recommend you speak with an employment attorney to determine whether your policy is going to protect you as an employer, in addition to protecting your employees and yourselves from COVID.
Okay, so this one is a little off topic, a little bit about the mask mandate, but
Yep.
do we have to require masks on in the office, or is that just up to the employer?
Well, it depends on what state you're in. If you're in Massachusetts, yes, you do. I mean, there are mask mandates here in Massachusetts. There are, the Mass website has the requirements for each type of industry, including offices. So right now, yes. And again, as of yesterday, with the signing of the executive order, federal buildings will also be required to have masks on at all times.
And then if someone has recovered from COVID, can that be used as a substitute for getting the vaccine?
That is a question for the doctors. And I was curious about that myself, because I know a few people who have recovered from COVID, and they're being, it's being recommended, the people I know, their doctors are recommending that they do get the vaccine still. So it is not known whether you can be reinfected by by COVID. So that's definitely going to be a question for the medical professionals. We'll stick to HR here.
Okay. This is a little tricky too. So if an employer mandates vaccinations and allows employees to begin working after the first dose, but the employee fails to take the second dose, because we know there's a 2-dose series, can the employer terminate the employment?
Again, you really want to be careful with those mandates, because I don't want to give you a black and white, yes, you can, because if they got their first dose and had a reaction to it and their doctor recommended that they not take that second dose, they may be eligible for an accommodation depending on the reasons for that. If it has something to do with something that would qualify them under the ADA, you may have to make reasonable accommodations. In all cases, and I cannot stress this enough, in all cases, you need to have that dialogue with the employee. You need to find out why, what's preventing them, what's holding them up. A lot of times it might just be time, it might be cost, it might be things that you can work around. And again, I think one thing we've learned through this pandemic is that many of us can effectively work remotely. And if that is an option for your employees, and even if somebody got the first dose and for whatever reason is choosing not to get the second dose, if accommodating them by allowing them to telework, it's probably going to be a good idea to do so.
I think we've answered this, but we'll just repeat it again. Not sure if this applies, but mass.gov states that individuals will get vaccinated either by their employer, primary care physician, pharmacy, or public clinic. How are employers expected to do this? And that's where we bring in a third party.
This is where you bring in the third party. Don't go out and stock up on syringes. I don't recommend that at all. No, I mean, only healthcare professionals or people who are trained can administer shots. So when they say employers, it's, as an employer, you might be required to make sure that everybody is vaccinated. But I don't think they're anticipating that you personally are going to give those shots.
And Gloria asked,
yeah. Oh, I'm sorry.
Sorry. Gloria asked a really good question. Can clients ask if people that are providing them service have had the vaccine?
meet vendors, or is that
Yeah,
what it,
like, yeah, I would say vendors or the clients that they work with, if that's okay, if they ask that if the employees have had the vaccine.
again, it's going to really be dependent on your industry and whether those individuals are posing a direct threat to your staff or to your customers. So I don't know that I could give you that one. Is probably one we would have to take offline because that's going to be too hard to answer without some background information as to industry and all of that.
Okay, are we gonna take a couple more?
I think we're right at the top of the hour.
Okay.
So we're gonna shelve that because I want to tell you all about, and those of you who've been on our ADA webinars before, have heard us talk about JAN, the Job Accommodations Network. This is an EEO sponsored website. It's a fabulous resource. Just in general, anytime you're dealing with any accommodation requests due to possible disabilities, this site has just got great information. You can look up reasonable accommodations based on the specific industry, based on your specific diagnosis or illness. It's got great resources. They have a terrific COVID page. And we have a link to that here. So the Ask Jan, the coronavirus disease 2019 page is chock full of great information regarding possible accommodations. The EEOC has also a great website, What You Should Know About COVID-19 in the ADA, and they're constantly updating that with more FAQs, so check back to that regularly. And then, as always, MP has our COVID Resource Center page that you can link into any of our pre-recorded webinars, look at our blog posts, ebooks, all of that. So with that, I'm going to throw it back to Jackie to wrap us up.
Awesome. Thank you so much to both you and Amanda for presenting today. We want to thank all of you again for attending this webinar. If you've been on any of our recent webinars, you already know that MP is currently offering services to help businesses claim employee retention tax credits and maximize their PPP funds. If this is something you might be interested in learning more about, let us know. You can email us at marketing@mp-hr.com or schedule a call with us via the follow-up email. If you have any further questions, please feel free to send them to marketing@mp-hr.com. We hope you all stay healthy and have a great day.